Welcome everyone. Today we'll be talking about pre and post surgery counseling. Surgery is a threatening experience with multiple stressful components including concerns about one's own physical condition, admission to the hospital, anticipation of several painful procedures, worries about their survival and recovery, and of course separation from family, even if it is temporary, even if it is for a short period of time. Accordingly, it's not surprising that studies have shown that even operations which are considered by physicians to be minor can provoke strong emotional reactions in patients. Research evidence also suggests that greater the distress or anxiety prior to a surgery is associated with a slower and more complicated post-operative recovery. Quite a few researchers have talked about this. So, psychological preparation then for surgery can help patients address several problems, potential problems that they face in many areas so as to prevent or minimize this impact that we have been talking about. Researchers who have assessed the impact of psychosocial interventions administered before surgery have generally demonstrated positive effects on post-surgical psychological and physical function as well as recovery. What basically is the impact of hospitalization on the patient is something which we have to discuss first. Patients arrive at the hospital anxious about their illness, anxious and confused over the prospect of hospitalization, and concerned with all the role obligations they must leave behind unfulfilled. Remember, everyone has several obligations and several roles which do have these obligations. The patient must entrust himself or herself completely to strangers in an uncertain and strange environment in which all procedures are new. As a result of all these that we have been discussing, and also owing to their own personality, which is undeniably an important factor, and of course the environmental factors, some patients may show psychological symptoms like anxiety, depression. While all surgeries have a risk of death, some surgeries have higher risk of death, and this results in the patient pondering about his or her own mortality. Surgical anxiety can be caused by the fear of the result of surgery, like for example an alteration in the physical appearance of the body, like for example in surgeries like mastectomy where a part of the body is removed. Anxiety related to tests or surgery and their results can produce insomnia, nightmares, and general inability to concentrate. And hospital care in itself can be fragmented, with many different staff members passing through a patient's room each day, conducting tests, taking blood, conducting several other examinations, some bringing food and some for cleaning up. In this way, several staff members keep walking in and out of the room. And often these staff members have little time to spend with the patient beyond exchanging mere greetings. And this can be a very alienating experience for the patient who is there in the hospital. And during these various tests and surgeries that we have been talking about, procedures that isolate or immobilize patients are particularly likely to result in psychological distress. Many patients with severe anxiety will postpone or even avoid surgery, even if it is very harmful to their health. They try to postpone or avoid in spite of that being very harmful to their health. Regardless of the cause of this anxiety that we have been talking about, it is essential to seek treatment so that patient's health does not suffer. Anxiety in itself can be a vicious cycle, with the stress and the physical symptoms of the problem causing sleeplessness, and this sleeplessness in turn makes the anxiety worse. And as a result, the ability to cope diminishes. So it's a vicious cycle, one leading to the other contributing to the earlier one, and so on and so forth. It's a vicious cycle. Now, researchers say that anxiety and depression are reactions to injury to self-esteem, feelings of powerlessness and vulnerability, helplessness to face adaptive challenges to the illness, actual or anticipated losses of independence, financial security, or social support systems. Many of these are contributory. Other reactions reported by several studies once again reported by various researchers are psychosomatic invalidism, and this is manifest in symptoms like anxiety, somatization, dysphoria and functional impairment, which are exaggerated beyond the actual condition. Sleep disturbances would be there, heightened sense of anger and irritability, and also marital conflicts may be there in certain cases. With all this in view, in advanced healthcare settings as in West and in developed countries, patients are given a roadmap of what procedures they can expect and what they may experience as a result. Such procedures are only still emerging in many of the developing countries. You know that even in India, these procedures are still in the emerging phases. And among the important developments in hospital care in this context has been the role of health psychologists in pre and post surgery counseling as well. Based upon the need and relevance, the psychologists may use certain psychological tests which help them determine the patient's psychological level of functioning, patient's strength and weaknesses also, which can help them form the basis of need-based psychological interventions. That's the reason why the strengths and weaknesses are also taken into account. Psychologists are also involved in pre and post surgery preparation, pain control, interventions to increase medication and treatment compliance, and behavioral programs to teach appropriate self-care following the discharge of the patient from the hospital. What is the need for these psychological interventions that we've been talking about? In fact, during pre-operative period, according to researchers, adjustment waiting for surgery is often characterized by high levels of anxiety and anticipation. Additional concerns in addition to this anxiety and anticipation related to anticipation, there are other psychological concerns as well, like helplessness, fear of impairment, seriousness of the surgery, fears of dying, future plans, post-operative plans, and of course appearance of incisions. As a result of several studies depicting the hospital anxiety and its repercussions, many hospitals now provide interventions which help prepare the patients generally for hospitalization and more specifically for the procedures that they are likely to undergo, specifically for that particular patient. So tailor-made interventions are there. Some of the major issues we would be discussing in the next module. Let us now discuss certain psychological interventions in certain contexts with relation to certain concerns as well. Let us first talk about worry as a major concern. We have been discussing about this a little while ago. In a landmark study which was done by Janus in 1958 regarding stress that many patients experienced both before and after their operation, that is surgery, Janus observed that without some anticipatory worry, patients were not able to cope well with the surgery. He termed this as a work of worrying, reasoning that patients must work through the fear and loss of control that are raised by surgery before they are able to adjust with it. Janus grouped the patients according to their level of fear that they experienced before the operation as three groups: high, medium and low according to the level of fear that they had before the operation. Then he studied how well they understood and used the information the hospital staff had given them to help them cope with the after effects of the surgery. Based upon the results, Janus reasoned that highly fearful patients had been too absorbed in their own fears preoperatively to process the preparatory information which the staff had given them adequately. Patients with little fear were insufficiently vigilant to understand and process the information effectively, whereas the patients with moderate levels of fear, in contrast to the patients who had high level of fear and low level of fear, in contrast the moderate level of fear patients were vigilant enough but not overwhelmed by their fear, so that they were able to develop realistic expectations of what their post-surgery reactions would be when they later encountered these sensations and reactions, they expected them and they were ready to deal with them. So, worry, to what extent worry can be there and how it can help and also how it can be detrimental has been discussed by Janus. Whereas Janus believed that fear and work of worrying are essential ingredients in processing information about the surgery, most of the researchers now believe that the effect is primarily determined by the informational value of the preparatory communication itself. So, now we are going to talk about preparatory information as the second ingredient, very important concern. What is preparatory information? Patients who are carefully prepared for surgery and its after effects will show good post-operative adjustment is what studies say. Patients who are not prepared for the after effects of the surgery will show poor post-operative adjustment. Most surgery preparations provide information about the procedures which they are going to follow during and after surgery, and also the sensations that can be anticipated, that can be expected. Patients who have been prepared in these ways are typically less emotionally distressed. Remember, this is an important component that we have been discussing. They are typically less emotionally distressed, they regain their functioning more quickly and are often able to leave the hospital much sooner compared to the others. In this regard, a study done in 1992 on 105 patients who had undergone major gynecological surgery for carcinoma of the cervix or vulva in the previous 5 years revealed that a high proportion would like to have more information on the after effects of the operation, and this included physical, sexual and emotional aspects. This shows how important a patient feels that a preparatory information should be provided. And the women who participated in this study by Corney, Everett, Howells and Crowther have also indicated their needs for emotional support, discussion and counseling as important, as being very important. So, this shows us how important patients feel that preparatory information should be provided to them. Now, preparation for patients is so beneficial that many hospitals now show even videotapes to patients to prepare them for upcoming procedures. Even with regard to this, there have been studies. There was a study with patients awaiting coronary artery bypass graft, it is called CABG in short. It was seen that compared to patients who did not receive any videotaped preparation, that is those patients who have not been shown videotapes of about the surgery, compared to them, patients who saw videotape felt significantly better prepared for the recovery period. They reported higher self-efficacy during the recovery period. They were more adherent to the recommended dietary and exercise changes during the phase of their recovery and were also released sooner from the hospital. Now, the third important component which we must discuss now is social support. The fact that emotional support from others can reduce distress when people are undergoing stressful events, any stressful event, is something which researchers have made use of in developing several psychological interventions and psychosocial interventions for hospitalized patients. In a particular study, researchers developed a social support intervention for patients who underwent cardiac surgery. Some of the patients were assigned to a roommate who was also waiting for surgery, that is in the pre-operative condition, whereas others were assigned to a roommate who had already had surgery, that is someone who is in a post-operative condition. In addition, patients were placed with a roommate undergoing surgery that was either similar or dissimilar to their own. So, three types of groups. So, the researchers, that is Kulik, Moore and Mahler in 1993, they have found that patients who had a post-operative roommate profited from this contact. This may be because post-operative patients were able to provide relevant information to patients about the post-operative period by telling them how they felt and what the patient might expect. This is once again explained by some researchers. And post-operative roommates may also have acted as role models for how one might feel and react post-operatively. Also, those awaiting surgery may simply have been relieved to see that somebody who had undergone surgery had come out perfect, all right. There are no conditions that he has probably been worrying about, whereas the patient is quite all right. Let us now discuss how this pre and post surgery counseling plays an important role. Patient counseling is an important part of medical or surgical management of a disease. In developed countries, this part is adequately managed, but as we said earlier, in developing countries, patient counseling is not being paid enough attention to. It just started emerging. It needs to be paid more attention. The reason may be because there are large number of patients per doctor, and the doctor finds it difficult to explain everything to the patient to deal with how to deal with their anxiety and apprehensions. It may be difficult for the doctor. Here, counseling then has an important role to play owing to multiple psychological issues discussed so far, whatever we have been discussing so far. For example, anxiety occurs when the patient has no idea as to what the surgery entails and is left to imagine what the procedure is and what the result would be like. And for many people, anxiety is a normal response to being expected to make a life-altering decision with minimal information. Counseling thus is helpful in helping the patient understand the necessary facts related to the surgery. In situations where surgery can have an impact on self-esteem, like for example in mastectomy, as I mentioned earlier, removal of breast, counseling may help the patient cope with the changes. Being able to discuss the concerns openly with someone who is objective can be very therapeutic in itself, especially as the family members and the friends tend to be emotional and subjective at times. The surgical process as well as surgical pain are major physical and psychological stresses, and extending from the decision to have the operation until recovery is complete, the whole process is quite stressful to the individual. Counseling, therefore, in the hospital setting helps the patients change their misconceptions, if any, about the illness, the need for the surgery, surgical procedures and the benefits of the surgery, as well as how to deal with the physical and psychological issues related to pre and post surgery phases. The counselor, in coordination with the medical team and the whole health team for that matter, and the patient and also the patient's family if needed, tries to help the patient deal with the situation from a holistic perspective. Counseling may also help patients who have had a bad or bitter experience with the surgery or healthcare in general to conquer their fears, whatever they are. Most therapists are able to recommend exercises to help control anxiety and the physical response to stress as well. Apart from the surgical aspects, counselors also help patients understand the importance of issues like adherence to treatment regimen, regular medication, follow-up and maintenance of personal hygiene based upon the kind of problem that the patient has. There are several benefits of counseling that way. The benefits of pre-surgery counseling, for example, according to several researches and research findings, appear to include many points. For example, less distress and anxiety both before and after surgery. If counseling is given before surgery, then fewer complications related to the surgery and recovery, less pain and less need for post-operative pain medication, shorter hospitalization period because the recovery would be faster, reduced healthcare demands due to the empowerment of the patient to take more responsibility for his or her own recovery, and increased patient satisfaction with treatment. So, all these benefits are seen when there is a pre-surgery counseling. What is there in this pre-surgery counseling? Counseling may involve a psychological evaluation before the surgery that can help identify the individual's strengths, like a strong motivation towards adherence to the treatment can be a great strength, adherence to the diet and exercise regimen, all these can be strengths. It can also help find areas where he or she might need support after surgery, like for example depression or mood swings or lack of family support sometimes, or triggers for past emotional stressors. The psychologist helps the patient in gaining a complete understanding of the effects of surgery and also understanding the psychosocial support systems which are available. The psychologist also helps the patient deal with the identified problem areas by facilitating optimal use of strengths and that we have been talking about, and identifying and also using, not only identifying but also using the effective ways of coping. Psychologists also support the patient look for ways to prevent disease and promote health in the future as well. Having talked about pre-surgery counseling and the benefits of pre-surgery counseling and counseling in general, let's also talk about post-surgery counseling. The needs of the patients may vary after surgery. They may not exactly be the same as those before surgery. While the needs before the surgery may surround informational needs about the surgical process, the chances of success and survival, and then hope for recovery and how fast the recovery would be, the speed of recovery anticipated, pain and others, the needs after surgery, that is post surgery, may involve separate informational needs like information seeking support, future course of action, what the future course of action should be, and others. Immediately following surgery, for example, they may have discharge information needs, information about further treatment, complications and impact on activities of their daily living, which if not satisfied, such needs, if they are not satisfied, they increase the levels of uncertainty. And there may be certain behavioral patterns which suggest a need for follow-up even after surgery. The patient behavior patterns, for example, after a bariatric surgery, for obesity, for an obesity patient, when bariatric surgery is done, behaviors like non-mindful snacking and nibbling on high-calorie foods between meals can be a problem if it is not identified and stopped before surgery and follow-up is done. So, such issues have to be handled. Post-operatively, the patient and the family may be overwhelmed with role changes. Remember, even after surgery, there may be several role changes. And there may be fear of discharge. Once the patient is discharged, what next? Several fears may be associated with it. So, consistent communication throughout the patient's stay in critical care unit is, on the other hand, an important and essential part after the surgery. An individualized care plan specific to the needs of the patient and family, according to researchers, is reported to produce greater satisfaction and lowered anxiety levels, thus enabling the spouse to provide greater support for the surgery patient. So, in addition to all these, one important area where patients may need psychological intervention along with the medical intervention is pain management. There are many different types of surgery, and with few exceptions, all surgeries are painful. We all know that pain is a subjective experience. The psychologist's role is to help determine the best pain management for each patient. Providing accurate information ahead of time about the surgery and recovery gives the individual a realistic idea as to what to expect during the hospital stay. For example, how much pain one is likely to experience, and it can also help them to relieve anxiety and fear, both of which, as we all know, as psychology students, we all know both anxiety and fear are known to make the pain worse. Understanding the factors that are associated with intense pain after surgery can be helpful in preventing or preempting post-surgical pain. Research studies have shown that providing information and education about pain and its management to patients can help reduce post-surgical pain intensity. Let us now talk about psychological techniques which are used for counseling. Pre-surgery counseling, post-surgery counseling. Some of the techniques which are both used for pre and post-surgery counseling include cognitive behavioral techniques to deal with stress, anxiety and fears that we have been talking about, and relaxation techniques, usually for pain management. Let us first talk about cognitive behavioral techniques, which are exercises which help to change the way a person thinks about a situation in order to feel better emotionally and also behave in a more healthy way, in a healthier way. These cognitive behavioral techniques help the surgery preparation in two ways. One is by directly decreasing pre-operative anxiety and fear, and second is by providing coping skills to help decrease post-operative anxiety and pain. Some of the techniques, they may include methods like distraction, cognitive distraction, thought stopping, identifying automatic negative thoughts, and developing positive coping thoughts. On the other hand, there is one more which we have talked about, that is the relaxation techniques, usually used when there is pain and for various other reasons too. Based upon the type of surgery, the physical and psychological comfort of the patient, relaxation techniques are taught. It's not that the same technique is taught to each and every patient. It depends, it varies with the patient, it may vary with the patient, and they are taught when they are felt relevant in that particular case and then in that particular context. The relaxation response, you as psychology students are aware, is a state of deep relaxation in which there are specific physiological changes that are exact opposite of the stress response. And what do they include? A decrease in heart rate, respiration rate, blood pressure, skeletal muscle tension, metabolic rate, all these, and oxygen consumption, which may increase usually under stress and anxiety. All these are, with the help of relaxation, reduced. They are monitored. Using relaxation response before and after surgery process can help in reducing pain, controlling certain symptoms like certain responses like nausea, enhancing immune system function and respiratory function, and others. While we have discussed all this counseling and the techniques and need for pre and post surgery counseling, most often this more or less is suitable to a normal adult. Now what about children? Children have certain special needs, certain separate needs, certain specific needs. So let's also let's devote a little time for discussing about counseling for children undergoing surgery too. When a child understands what the illness is, what it feels like, and how soon he or she will get better, anxiety will be reduced. Researchers now believe that even very young children should be told something about their illness and treatment and encouraged to express their emotions and ask questions. Addressing anxiety is very important, as studies have repeatedly shown that children who are calm before surgery have better treatment outcomes. Children should be told about the procedure with enough time to have their questions answered as well. Research also shows that exposure of children about to undergo a surgery to a relevant film of another child being hospitalized and receiving surgery showed less pre and post operative distress. Remember, we talked about the same thing, about the similar findings with respect to the older adults as well. Older children seem to be well served by seeing such a film several days before hospitalization, whereas young children may need exposure to such information immediately before the relevant events. Coping skills preparation has also been found to be helpful with children. So what has been discussed with reference to the older adults also seems to be relevant with reference to the children with more care and concern.